Hello and a very warm welcome to everyone for the launch of the National Safety and Quality Cosmetic Surgery Standards. My name's Janice Peterson and I am delighted to be your MC today. We're broadcasting from the lands of the Gadigal people of the Eora Nation, so I'd like to start by acknowledging the traditional custodians of the lands on which we meet today. We pay our respects to elders past and present. We also acknowledge the Aboriginal and Torres Strait Islander peoples joining us today. On behalf of the Australian Commission on Safety and Quality in Healthcare, I'd like to thank everyone who's registered their interest in these standards and a warm welcome to everyone. We really hope you value and benefit from today's launch. Well, many of you submitted questions when you registered for this event. A big thank you to you for that. And the Commission aims to address as many of those as possible right throughout this launch, but it will also continue to respond to those requests for information over the coming weeks and months. Well, today we will be talking to leading experts on how the cosmetic surgery standards will improve care here in Australia, also what the changes mean for the cosmetic surgery industry and consumers, and also, very importantly, the next steps for implementation. But it gives me great pleasure now to introduce the Honourable Mark Butler, Minister for Health and Aged Care, who will officially launch the cosmetic surgery standards.
Well, hello, I'm Mark Butler, the Minister for Health and Aged Care, and I'm recording this on Ngunnawal and Ngambri country. I pay my respects to First Nation elders, both past and present, and I extend that to all First Nations people taking part today. It's a great pleasure to be able to officially launch the first National Safety and Quality Cosmetic Surgery Standards. Our government is committed to improving the safety and quality of care that consumers undergoing cosmetic surgery in Australia receive. As part of wider reform in the cosmetic surgery sector, the Australian Commission on Safety and Quality in Healthcare was tasked with developing national safety and quality standards for the safe delivery of high-quality cosmetic surgery. The cosmetic surgery standards are Australia's first nationally consistent safety and quality standards for this sector, and this is really significant. Facilities where cosmetic surgery is performed can take immediate action to implement these standards. By doing so, patients will have the necessary confidence that services and clinicians providing cosmetic surgery have the systems and processes in place to meet and maintain the expected standards of care. In line with the reforms being implemented by the Medical Board of Australia, AHPRA and states and territories, facilities performing cosmetic surgery will be required to undergo 3 yearly assessments. To reach this point and through developing the cosmetic surgery standards, the Commission consulted extensively with subject matter experts, consumers, peak and professional bodies and other stakeholders. And I'm really grateful to all of those who contributed their expertise, their time and their views. I'd like to congratulate the Commission on developing a set of standards that are written from the consumer's perspective. This is so important as the consumer voice and public experience was the catalyst for these crucial reforms. I'd also like to acknowledge and thank our expert speakers for participating in this event and in the development of the standards. I hope you enjoy and learn from the presentations and discussions and take away a clear understanding of what you can do to drive safety and quality improvement across the cosmetic surgery industry. The public expects this from us, and I'm confident that together we can deliver on this expectation. As part of the rollout, the Commission will provide additional support and education throughout 2024 to help cosmetic surgery services familiarise themselves with the standards. Thank you very much.
Thank you so much, Minister Butler. Well, we know that these urgent reforms are designed to build stronger protection and also to improve patient safety for people undergoing cosmetic surgery here in Australia. And many of us will have seen the media coverage with patient reports of the very serious safety issues that they've experienced. And on that note, I'd like to now introduce Charlotte Jerram to give us some insights into her experience following breast augmentation and to see how these new standards might help anyone seeking cosmetic surgery. Charlotte, thanks so much for joining us today and for so generously sharing some of your experience. Tell me more about that. What happened when you got cosmetic surgery?
Absolutely. So I was quite young when I decided to have my breast augmentation surgery at just 19 years of age. At the time, I really didn't know what to expect, and I only had a short consultation with the cosmetic surgeon. It was a pretty fast consultation with quite a high level overview of the procedure and then the recovery. Fast forward, I did agree to go ahead with the surgery, but I did end up having many issues over the years with my implants. I now look back at this time and I believe that I was suffering from an illness called breast implant illness. So from that, I then made the proactive decision to explant, and I explanted in March 2022.
Reflecting back on those times, what aspects of your care do you think could have been improved?
In hindsight, I feel like I probably wasn't given enough information to make an informed decision. I do feel in a way, because I was very young when I went with the procedure, I feel like it was really sold to me at the time. I wasn't really told about the potential risks, complications, or even any future screening or post-operative care. I also wish during that time someone had spoken to me about the reason for me getting my implants and made the connection back to my mental health. So for me personally, I've always struggled with body image and confidence challenges growing up. So if you add that and the pressures of social media, it really did influence my decision back then to proceed with the surgery. However, going forward, with these new standards being introduced, I hope that it will obviously protect patients and ensure that they are suitable for cosmetic surgery for the right reasons, which also might include assessing their psychological health before proceeding with surgery. I think it's really important that people can make informed decisions, but then also that they can understand the possible associated risks. Looking back on my situation too, I feel like this information really would have assisted me. And it's likely if I had access to this information or known about the possible complications, I probably wouldn't have proceeded with the surgery.
I think a lot of people would take a lot away from what you've just said there, Charlotte. So is there any other advice that you might give someone considering cosmetic surgery?
Absolutely. So the first thing that comes to mind is informed decision making. So the whole process of surgery and consultations can be quite overwhelming. Don't be afraid to ask questions, to take notes, whether that also be taking a support person with you to appointments. And if you have any questions, know that it is okay to follow up with the surgeon, even if it's post-consultation. I think it's important as well that you talk about and discuss the risks and complications that might come up with the particular surgery. And the last thing is probably ensuring that you have aftercare and you know what happens post-operation, whether that be months to years. I think you need to allow yourself to be prepared for these consultations, and that's something I deeply regret not doing at 19 years of age. I really wish, looking back on my experience, that I had gone into these consultations with questions, and it probably would have helped me process and make a proper informed decision. Just to close out as well, I think that if you do have an issue with any of the information presented, that you can talk to your surgeon about it and report the issue. So to answer your question, Janice, the last piece of advice I would say is everyone obviously has their reasons for undergoing surgery, and that's okay. But I think going forward, we all just need to make sure that we can do this within a safe and supported way.
Charlotte, thank you so much for sharing your thoughts and your experiences with us today.
Thank you for your time, Janice.
I am delighted now to introduce Conjoint Professor Anne Duggan. Professor Duggan is the Chief Executive Officer at the Commission. She's had a leadership role on the Medical Board expert panel relating to the review of cosmetic surgery. She also has an in-depth understanding of the complex issues surrounding safety and quality in healthcare. So, Anne, thanks so much for being here. We really appreciate your time. We've heard that the Minister, of course, is overseeing these urgent reforms in the cosmetic surgery industry. But where does the Commission fit into all of this?
The Commission's worked very closely with the Department of Health and Aged Care, the Medical Board of Australia and the Australian Health Practitioner Regulation Agency. Together, we've been putting in those reforms. Now, the Commission's focus is on safety and quality in healthcare. So we have been focusing on that area. And as you probably know, our expertise is in the development of standards to ensure that patients, wherever they are, get safe care and get the appropriate care to their needs. So in that space, we were tasked to look at the standards for cosmetic surgery and ensure that cosmetic surgery is not strictly within the health system, so to make sure that we had in Australia standards that protected people who were having cosmetic surgery.
Well, tell me a little bit more about that. How do the cosmetic surgery standards fit with the existing national standards?
So in Australia, every hospital and day surgery and dental practice is covered by the National Safety and Quality Health Service Standards. As I said, these ensure that people are getting safe, appropriate care. What we did was we looked at the issues to make sure that we had standards that covered specifically the problems that we were seeing in cosmetic surgery. So we developed cosmetic surgery standards, and they complement the National Safety and Quality Standards, which are really the foundation.
So, Anne, how did you determine then what the key safety and quality issues were for cosmetic surgery?
It was very important that we actually understood what the problems were. So we put together an advisory group of all the relevant stakeholders, the people working in the industry, clinicians, peak bodies, consumers, regulators. And we also then looked across the world at cosmetic surgery and looked at the peer-reviewed literature and all the academic literature. And of course, in developing the standards, we did send them out for consultation to make sure that there wasn't anything that we'd missed. So that provided the foundation to develop some very robust cosmetic surgical standards to address the key issues.
So how do you know if these standards are working, and how do you measure their success?
There were some specific issues that we needed to address in the standards. It was ensuring that people were accredited to do the surgery. We need to make sure that the advertising was consistent with what AHPRA guidelines were. We knew that there were a vulnerable group who seek surgery who possibly are better managed by seeking the help of a psychologist rather than surgery. So the standards included covering that issue of psychological safety, making sure people were appropriately assessed, but also that they had sufficient time and information to make an informed decision. The standards require that people are suitably qualified, that there is informed consent, that there is sufficient time for people to be able to think about whether they do want to proceed or not, and that the advertising that is surrounding this is appropriate. So there's some of the high-level issues that the cosmetic surgery standards really focused on to make sure we have a much more robust approach and a safer system in Australia.
Professor Duggan, thank you so much for so generously sharing your thoughts with us today. I really appreciate your time.
Thank you.
I'd like to now introduce Christine Gee. She's the CEO of Toowong Private Hospital, also the president of the Australian Private Hospitals Association. Christine, it's such a pleasure to have you here today. We have heard about these standards, of course, we've heard about the Commission's role in safety and quality, but what role does the private sector play in all of this?
Being involved with the private sector, I've been a long-time advocate for making sure that the private sector is actively involved in the development and the implementation of various safety and quality initiatives. Until now, the cosmetic surgery industry has really not been covered by any nationally consistent safety and quality standards at all, and the absence of those standards, as well as some differences within state and territory licensing and legislation regimes. And of course that a lot of cosmetic surgery practices are small single operator or a couple of doctor practices. That all has led to quite a lot of inconsistency in practice. And I'm sure many people have been shocked by the revelations that have come out in the past couple of years.
Indeed, yeah, it has been pretty shocking, some of the negative stories. How will these cosmetic surgery standards change the industry then?
So certainly the launch of the standards is a very important turning point, I think. It really will provide a clear, nationally consistent set of actions for cosmetic surgery operators to adhere to, which will hopefully ensure patient safety and the quality of their care, which is the most important thing.
As you say, it provides some consistency across the sector, but what does it mean for the people seeking cosmetic surgery?
Anyone undergoing an invasive surgical procedure really should be able to expect that the treatment they receive is safe, that it's respectful, and that it's appropriate. These standards provide a framework to ensure that any service providing cosmetic surgery will do that for their patients and their consumers. I've been working on improving safety and quality in private hospitals for many, many years, and I truly believe that when you act to protect the best interests of patients, everything else follows. Safety and quality follows. So if we put the consumer at the centre of the care being provided and work towards making sure that they're safe and that the care that we give them is a quality service, then everything else works.
So, Christine, do you have a message for individual practices in the industry?
Certainly. From now on, every practice really should be working towards implementing these safety and quality standards. These standards and the broader reforms are exactly what we need to turn around the reputation of cosmetic surgery in Australia and once again establish it as one of the best in the world. And most importantly, we need to do this for the consumers.
Indeed. Thank you so much, Christine, for joining us.
Thank you very much.
It's my great pleasure to now welcome Dr. Gary Buckland. Gary is a consultant specialist in plastic and reconstructive surgery. He's also the director of the Australasian Foundation for Plastic Surgery. So thanks so much for joining us today. Gary, we have heard about these standards. Of course, we know that these standards are part of a key suite, really, of essential reforms. But how will they apply to plastic surgeons?
Well, unfortunately, the reputation of cosmetic surgery and the integrity of some of the physicians who practice it in recent times has reached an all-time low. And these standards, combined with APRA's raft of reforms, are all addressed at trying to make the necessary changes to restore patient and community confidence, not only in the sector, but also in the physicians that practice in it. These standards work hand in hand with the APRA guidelines in order to restore patient and community confidence in the sector. And the reality is that cosmetic surgery is no different to any other form of surgery. And all surgery, including cosmetic surgery, has risks and complications. And it's the aim of the cosmetic surgery standards to basically minimise these risks and assure patients that they are being treated in the safest possible manner. And the new national standards also work in combination with the APRA's raft of reforms that address things like skills, training and qualifications. And this is all an important part of reassuring patients who are seeking cosmetic surgery.
And we know, though, the reality is, Gary, that change is sometimes intimidating for people, even though it may be well-intentioned. What do you think about that? Will these standards be welcomed by your colleagues?
It's a very good question. So as a plastic surgeon, I've operated under the guidance of the national standards for a long time. And I've done that not because we're legally obliged to do it, although that is the case, but rather because I want my patients to feel that they are being treated in a safe and quality environment. And that's a really important part of someone who comes to see me as a plastic surgeon. So the standards are also there to not just protect the patient, they're also there to protect the practitioner, because what they do is provide a gold standard in terms of how we should all be practicing. And that protects the patient, the practitioner, and the community in general.
There will, though, inevitably be outliers. There will be people who will want to push back on this. So what would you say to those practitioners who might be resistant to these changes?
I think anyone who operates on a patient, no matter what field that's in has a sense of personal and professional responsibility to themselves and to the patient. So that's the first thing. The second thing is that if they don't want to conform to these standards, then they shouldn't be performing surgery. And those that are performing surgery, I think that they should welcome these changes, because it actually provides them with a guideline of how they should conduct themselves in a professional manner. So I think overall, in a field that's lacked regulatory rigour for a long time, patients should be reassured by these standards that they are being treated in a safe environment by qualified people, and that this is an absolute improvement in the way the field of cosmetic surgery should be conducted.
Thank you so much for your thoughts. Appreciate your time.
Thank you.
Well, I'm now pleased to introduce our last speaker, Margaret Banks. Margaret is the Director for the National Standards Program at the Commission. She's led the development and implementation of the National Safety and Quality Health Service Standards and a program of systematic accreditation reform right across the Australian health system. So, Margaret, thanks so much for being here today. Today, of course, does mark the launch of the cosmetic surgery standards. Where do we go to from here?
Well, the first step is with the release of the standards, organisations, cosmetic surgeries can start putting the standards in place. The standards themselves provide a consistent framework for safety and quality, and that should give the people going there confidence that the risks that they face will be reduced. The accreditation system will follow, and so all organisations where cosmetic surgery is being provided will now need to comply with the standards. Those organisations that are already accredited to National Safety and Quality Health Service standards will have a small additional set of standards that they need to comply with to meet the obligations under these standards. Those organisations that haven't previously been accredited will need to pick them up and become accredited within the next 12 months or so.
And Dr. Buckland touched on some of the regulatory issues in the sector, and that's been experienced there. Will they be fixed by these standards?
There is a regulatory framework that, with the development of a licensing framework that underpins all of this work. The requirements are being implemented by states and territories, and there are some differences, and so some states are already fully implementing that regulatory framework and they're going to be in place. Other states have given their best endeavours to put that in place over the shortest possible period of time. But in the meantime, there are powers that states and territories have, and the other regulators, that can allow these to be put in place and breaches to be identified and managed in the meantime.
And this is, let's face it, it's a lot for people to absorb and to take on. So after this event, will there be further resources, information and support implementation in terms of these standards?
There'll be resources developed. We've got a series of them. They'll be for the services putting the information in place. They'll be for consumers who are looking to undertake cosmetic surgery. We'll be developing resources and instructions for those assessors that need to go in and do the assessment, because this is a new sector that they've not necessarily been in before. So there is a range of different resources that will be in place to support its implementation and management over the next 12 months.
That's wonderful to hear. Thank you so much, Margaret, for your thoughts. Well, that brings us to the end of today's launch of the cosmetic surgery standards. On behalf of the Commission, I'd like to thank everyone who has attended and also participated. I think we can all agree that the implementation of these standards will be beneficial to all who perform cosmetic surgery and also those who receive it. The Commission will keep you up to date on the development of the resources for the cosmetic surgery standards, and you'll find the standards and a whole lot more information on the Commission's website. A reminder, the recording of this webcast will also be available with further resources to be released in the coming months, so look out for that. Please tell your colleagues about this event and share the resources widely. My name's Janice Peterson, and again, thank you so much for joining us. Goodbye.